This is Dr. Francisco Jacome. I'm from Doctor Specialist Bariatric and Surgical. I'm originally from Ecuador. I was born and raised in Ecuador. I did my medical school also over there. When I was done with medical school, I moved to Tampa, Florida, where I studied to take my certification boards, the USMLEs. I spent about a year in Tampa, and then I moved to University of Miami to do a observer over there. While I was doing my observer over there, it was the very first time that I was in touch with bariatric patients and bariatric surgery. After being in Tampa, I did my residency program at East Tennessee State University, Johnson City, Tennessee. And from there, I returned to University of Miami for a bariatric surgery and interventional endoscopy fellowship. Everybody has this, sensation of, or experience of somebody got sick or close call of a family member. In my case, I had nothing. I just woke up one day, I was in 5th grade, and I decided not only that I wanted to do medicine, I decided that I wanted to be a surgeon. I didn't even know at that time that I had to do medical school to get where I'm at. But from then on, I really never had any deviation. It's always been guided towards becoming a surgeon. And later on in my residency, when I was a 3rd-year resident, it was bariatric surgery at that point. But never a doubt, never a question of what path I wanted to take. I call it a calling. I think it was a calling. Bariatric surgery is a life-changing event. It actually is very gratifying from the physician side as well as from the patient side. I get to see my patients' transformation from having difficulties even mobilizing to feel complete freedom in their lives. So for me, bariatric surgery is a new opportunity, it's a new life, it's a new chance of do it again that we give to the patients. And it's very, very, very gratifying to see the changes that we create in them physically, mentally, as well as their own health. The impact that is created on the patients is huge. Is seeing complete transformations. I mean, we receive usually a patient that has certain limitations, and when they are done with the weight loss, they're a completely different person. They grow as a person, they grow in confidence. Most of them actually grow in their careers, and they completely turn around and transform their lives. The impact is huge, not only on the personal aspect, but again, health. We have patients that come taking 20 medications, and then once they have lost the weight, they actually only take vitamins. No diabetes, no blood pressure problems, no sleep apnea. Their whole life changes. I love seeing patients after surgery. It's amazing how we see them in certain intervals. So at the beginning, it's very short intervals, and you can see some changes, but then the interval is 3 months, and a lot of the times I can't recognize them when they come back. The sound of their voice or reading their name makes me recognize them, but it is amazing. I mean, it's extremely gratifying. I have patients that have gone from being very oppressed in abusive relationships to flourish as professionals in their own life. I have patients that have gone from being on a stretcher, unable to breathe laying down, to be able to run a half marathon, oxygen dependent, to complete freedom away from any other problems. Patients who have been in the need for a cardiac transplant, then that their heart function improves after losing surgery. So it is amazing, all the stories that we have from it.